Okay, on to our next speaker. Our next speaker wowed the audience at our Intelligent Health event in Basel in September, so we're thrilled to have her here. It's Sofia Couto Rocha, Head of Innovation and Head of Virtual Client, Lusíadas, Saúde, here with us again, all the way from Portugal. She's here to talk to us about how exponential technologies are boosting a new future for healthcare. So please give her a very warm welcome.
Hello. It's really a pleasure for me to be here. It's the first time in Qatar. I'm a medical doctor by training. I also studied engineering, and now I kind of live with both of them, between clinicians' life with longevity and with innovation, implementing this technology that most of people think they are impossible to implement nowadays. So I'm going to start with a very basic question because I need your help. Could you think about apples, please? Think about apples. Okay. Now please help me. Who thought about red apples? Could you raise your hand? Thank you. Green apples. Okay. Yellow apples. Apples has being the phone or an apple. This apple. Any other type of apples? Okay. So that is exactly the problem that we have with technology. Even with the basic concept like apples that we grow up knowing what is it from heart, we have a huge variety of feedback when we think about it. So the concept that we have is hard. Now expand this concept for AI or for robotics or for anything else. If I ask our previous speaker about robotic surgery, imagine what he would think about. Now imagine about myself. I implement robotics, but I don't work with it. So each of us has a specific concept on those new topics. And as they are new, each of us would adapt it to our experience. And that is very important because most of the times when we are talking about exponential technologies, the different people in a room are thinking about exactly very different things. And that is a problem for implementation. So let me ask you to think about a hospital, okay, in the past. Hospitals are a concept that came up in the Middle Ages, right? In the 13th century, more or less. And they were houses where you aggregate people that were sick, right? Now think about nowadays hospitals. They are places where you aggregate people that are sick, right? Well, we start to have people that are in the prevention landscape. But they are still very likely. We have patients, we have doctors, we have nurses, other people that care about patients, and we have them all aggregated in a house. So we changed a lot, but we didn't change that much, right? So what can we do to really disrupt this concept from our times? And that is the challenge that we have probably here today, because AI is playing a huge role. So I don't know if you are familiar with Moore's Law, but Moore's Law, it's a very interesting concept that was predicted in the 60s, that every time we double the transistors in an integrative system and it comes to half a price, technology would evolve, right? And it has passed for the last 60 years. Now with silicon, with 3D printing, with other new technologies, and the future with quantum computing is going to be a little bit different. But this Moore's Law allowed us to think about what could be possible in the next 24 months. So think about it. Okay, why am I talking about transistors? Transistors are the cell for technology. It's kind of the same for us, right? So every time I double cells and I make them half of the cost, I can evolve technology, right? So now think what would be the impossible possible. And that's where these amazing new concepts or new technologies came up. I could have written different ones, I selected 12, but exponential technologies have something in the back that is common to all of them. They can really disrupt lives, and they do not disrupt one life. They can disrupt 10 billion lives per year, or even more. So let's go around it. So AI and machine learning, everyone is already listening about it for a long time. Now we are thinking that is new, but conceptually it comes from the 50s. Only now we are able to make it happen and to see the impact and to play around. But we are by far not in a steady state, right? There's a very common and very well-known Gartner graph that shows how we inflate our expectations with the new technology, then we come to delusion, and then we reach the plateau, right? We are far from the plateau. And AI, we are playing with it, kind of how we played with light when it appeared, electricity. So we applied it to everything. And then we measured to see what is not. And that is where we are now, right? Right in plateau. my mic is better. So then, biotechnology and CRISP. CRISP is probably one of the most promoted and a promise for the future about biotechnology. And I think it's going to be probably the next 10 years one of our core for, of course, medical innovation part. Then when you think about IoT and mobile, please do not put the medical in the middle of IoT. Do not put the IoMT, because we want to put intelligence in places that are not medical. We want to have our fridge or our mirror in the morning to help us, not a specific device that maybe 1% of people will have it, right? IoT is probably one of the most important ones to take us out of the hospital concept from the past, because it's going to connect everything and give us information. Is going or is already doing it in some places and in some specific ecosystems. Then nanotechnology is allowing us actually we do a lot of research in nanotechnology, sometimes with some particles like gold, for instance, and it's super interesting how it is able, or how it's being able in a lab environment to do really interesting things in terms of therapeutics targeting. Then let's go for energy storage, because all of that demands a lot of energy, and that's how and why some of the big companies in technology are actually buying electric power centrals, right? Because we need electrics. But that is something that is probably also changing with the clean energy in the next years. I'm not sure about how many, and that's probably one of the parts here that I wouldn't do a prediction, because I think that's a very hard one to get. Then AR and VR. When you think about new realities and a new way to approach patients, for instance, we are now being able to join virtual reality and augmented reality in a concept of metaverse or in a normal concept. So think about teaching in this concept. So putting everyone in the world that does very specific surgery or very specific procedure, just teaching everyone that wants to learn at the same time. We already have some initiatives with proctoring. I don't know if you are familiar with the concept, where we have these AR classes and sometimes with support of VR as well for education in a long distance. Then when you think about blockchain, has unique data, as we've seen in not the previous speaker, the one before, that was showing that data is crucial in terms of value and also in terms of allowing us to have these implementations. We need safety for that data. So I think blockchain is going to play a huge role in the next years. Then robotics, I'm not going to go on this one, as we just assisted to an amazing 20-minute session. And then I saved 3D printing and quantum computing for the end, because those ones probably together or by itself are going to be huge players for the next years. Quantum computing is probably going to disrupt all this concept of Moore's law evolution, so how much time we need to change things. Ray Kurzweil, which is a futuristic and a person that I think thinks really in a very interesting way. When everyone was saying that things were impossible, he was putting the date on the things. So Ray Kurzweil always says that in his accelerated evolution theory, he says that whenever we reach a moment where technology is not able to evolve, we have a new technology that boosts for the next step. And probably quantum computing is the one that is going to allow us to do the jump as next step. If I have to choose 3 technologies that are playing a major role nowadays in healthcare, I would choose the cloud, because we can save data, a quantity that is huge, and we can access from wherever we are. Then AI, because we need help to organize all of that data. And then mobile, because we need to access, right? When I think about mobile, it's not just a mobile phone, but a computer. So to have this portability that is so needed. So if you think about the entire world, now accept that concept that the hospital is just in these 4 walls, and think about the entire world as a hospital setting. So beyond the walls, with this technology, we could think about this next step for healthcare. And now let me go a little bit out of the technology part and go for how we see care clinically, okay? So we are starting to talk a lot about the 4 Ps, right? The predictivity, the preventive approach, the personalized approach, and of course, anticipatory part, so that we go out of the paternalism and we have the patient really interacting and deciding by himself. And let me add one, which is proactivity, because we need to aim for that. We cannot just say that this is a very nice trend and that we are moving towards it. We need to proactively re-engineer the system to get these 5 Ps. Most of the hospitals nowadays, which actually have really good KPIs and really good metrics, are not designed for these 5 Ps. They are much more designed and focused on health and a disease care system and ecosystem than in a healthcare system. And that is a challenge for the future, for decision makers mainly. Then we also know, as a new setting, that many new players are entering this field. We know that big ones like Amazon, Microsoft, Google, Walmart, many startups and Apple, they are playing a huge role in this field. They are also playing a role in how the disruption is made. So now we know that there are different approaches, like Google thinking that we don't need to have a medical device certification for some tools, Apple pushing it for the certification, and these different approaches and these different ways to see it are actually impacting a lot the present and the future. And that, of course, brings us ways to deliver health, because it's coming to this beyond the walls approach. So we jump out of the concept, the classical concept, and we tend to go home or to work with the people. Why is that so important? Think about data. So there are a lot of studies that show us how much data we have in clinical facilities. And just to give you an idea, or actually I'm going to ask for support. Who thinks it's up to 10% of data are in clinical facilities? Please raise hands. 10 to 20%. 20 to 30%. More than 50% in clinical facilities of healthcare data. Okay. So I need to give an insight, which would be similar to the Apple's exercise, which is what is clinical data, right? Are we talking about just health data, disease data, or wellness data? So nowadays the approach is wellness data. So everything that I eat, how much I exercise, where do I go in my daily basis are all health data. So the paper shows that it comes from 1% to 3% are in clinical facilities. So all the rest of the data is outside these walls. So we really, really need to have access to that information as well. So that's why it's so important to think about new ways to approach this. So if you join all of that, so all the technologies that we are talking about, we have, of course, more data everywhere, able to be interconnected, enjoyable because people can actually contribute to their own health and they can connect and control, because many patients who are actually more and more patients, there are some studies that show us that over 80% of the population are now controllers of their self. They are like new categories where they really like to see how much steps they give every day, how much water they drink, and so on. They measure in average more than 4 parameters with their phones or watch. They are easier to find that data because now we have engines that actually can show us and export data in an aggregated and structured way. And then, of course, we can generate knowledge because data is way different from knowledge. We are now in this moment, going back to the graph, where we are a little bit in delusion because we collect a lot of data and then we cannot put value on the top of it. And that is one of the things. But virtually, we have an unlimited capacity. And that is something that people that are actually in the decision making and that are in the clinician setting that actually can take a decision and can boost this. And that is the responsibility of everyone probably in this room. So then let's expand it from a clinical setting or from hospital to a city. One of the challenges that, of course, cities have is real-time decision, or the proxy for real-time. And it's something that with this type of technologies, let's imagine, you can have not even real time, you can act before. So let's put it in the limits, where you have someone that is measuring all his heart rate, what he's eating, how much he's sleeping, and so on. And there's an engine that is computing all that information and can act or react, saying that proactively, the probability to have a stroke, for instance, in the next hours is super high. Think about it, how a city could react on that, how you could have your SOS system proactively reacting to that. I know that proactively and reacting are a little bit contradictory, but in this setting, that would be the reaction in a proactive way. That would save millions, maybe more, in cost, and also it would save life and cells. Let's think about stroke, but we can think about any other concept around that. So let me put it in a nutshell. When you think about those technologies, how could you potentiate it? So you would have a personalized medicine, which we are nowadays talking about it, but it's still not there. So some of us already use genomics, We already use microbiome, proteome. We use blood samples for sure to see how it is in the moment. We use a lot of measures from technology. Let's put it all together and take decisions on that. That is no longer virtual reality or future reality. It's of course not yet n equal to 1, but we already have a very nice way to cluster in a shorter way. No longer just saying that we are from this ethnicity, we live there, and we are around a cluster of 40 to 45 years old. We are already one person. Then think about remote monitoring as something that is normal, where you have, for instance, towers of, let me call them control towers, which is the same as we have in airports, more or less, where you have some professionals, highly differentiated, doctors, nurses, physiotherapists, that can follow thousands of patients in distance with higher quality, with a much lower price. Then think about augmented intelligence. And I think more than artificial intelligence is how we mix natural and artificial, how we have this augmented capacity for human beings. Because in terms of regulatory, it's much easier by now to use it and to implement it in an immediate moment than it is with artificial intelligence. Then think about how the monitoring digital health. So this monitoring, but more in distance with centralized, highly differentiated systems. Think about, for instance, diabetes, which is, let's go to the nowadays reality. When you have a lot of patients in the world, some are well controlled, most of them are not. We know that the issue is in food more and in habits more than in medication. So how can we not do it? Then think about how this would represent value for healthcare. We need to think about economics as well, because the total cost of care would go down and we would reach more people with better outcomes. Then think about those 12 exponential technologies or approaches, how we could apply them to the nowadays setting. Because we have very different speeds in the world. We have very good examples of a specific exponential technology applied in a place, and then you have what is the normal range, right? So how can we expand those use cases to the reality of nowadays? And then think about primary prevention, real primary prevention, not what we mostly talk about primary prevention, which is normally just a way to handle a very good, handling in a better way, a chronic disease. And then think about this data integration. We know that now in Europe, with the European Health Data Space is going to be one of the first data lakes that actually aim for a difference, to make a difference in this. Let's see how it goes in the next 5 years. So this prevention landscape, where you have everything playing together, would drastically change the concept of a hospital. But let's think about the citizen as well. How we put citizens in the center of this, how we make them, how do we change the conscience? And when we talk about apples, now between commas, when we talk about health, how can they all think about the same when we talk about it and not about disease? How can we switch this capacity to handle their own and proper health, to own their own health? So just a challenge to end. How does the hospital of the future look like? So when I'm talking about future, it's near future. Maybe, well, I asked the support, I described it, and I asked the support on to help me draw it. Those are not screens, those are holograms, so that we don't use screens, because we know that we are in the middle between that, right? Using screens or not. We are already having some holographic images for some auto-diagnostics and auto-screening patients, which is a challenge that is super interesting to see the reaction of patients using it. But let's think about it. We know that for the 4 or 5 Ps, we need to have interaction with nature, we need to have the reality of at home in the hospital. So we know that recovery is better at home. We know that eating, sleeping, all the pillars of health are improved when we are in our own environment. So how can we manage to have this own environment, even if it's real reality that is not our natural reality, virtual reality or augmented reality? How can we make it near to what we have at home? We also know that nature plays a huge role. And this is no longer esoteric, this is totally data-driven feedback. So how can we make it incorporated, embodied in our hospitals? This could be a tower of control, the ones I was telling you. How to manage chronic disease with patients using this 97 or 98% of data that we do not have in our healthcare facilities. And how can we see the interaction with our clinicians? How that interaction would be? how would that look like? We would be much more in an integrated system where the clinician would reach the patient knowing much more about the patient, not just what is the disease-related information from the patient. Because we all do really good clinical histories, but we use all the tools that we have nowadays to potentiate the decision-making process. That would be like an environment that could allow the patient to have a huge role on that as well. And with that in mind, I finished my presentation asking everyone to think that in the future, and when we talk about any concept, it would be really good if we could converge concepts in the same. So whenever we think about apples in a room, that we could, before starting getting to the point that we want, to make sure that everyone is looking at the same apple. Sorry for the analogy, but I think it's a very easy one. And that is what we aim to do in exponential technologies, that the reality that we have nowadays when we try to implement any project or any new process, that is clear to everyone. So thank you very much for the opportunity and looking forward to the panel.
Thank you so much, Sofia. That was incredible. And we actually have a bit of time for a quick Q&A before the panel discussion. So if you have any questions for Sofia, please raise your hand now, and we can have a microphone given to you. Oh, we have one there.
Hi, Sofia. Thank you for this information. My question.
Speak up, sorry.
Yeah. Hi, Sofia. Thank you so much for the information you gave us here. My question is an opinion of yours on why traditional EMR system, which are having at least 80% of the footprint in the hospitals, are not innovating in AI for the healthcare. Rather, Google and some third-party companies are doing it. What is your opinion on it?
Why they are not applying the AI capacity, full capacity? Okay, so I think there's two parts in that. One of the reasons is because of data. As we know that there's huge capital on data, so it has value, intrinsic value, and secondary and tertiary value. And I think most of hospitals, we don't have this the data structuring can allow people to access to train models, for instance. We are now starting with a concept that is federated learning, that is probably clear for everyone, but which allows us to actually share our data without having the data going out of our premises, and that we connect everyone in the globe, in the future, who knows? So some hospitals connected to train models, so that then the models can have AI in the EMR. I think that is crucial. We already use it in some specific tools, like for instance, when we do prescription, we have a support system that allows us to have help, for instance, that receives the blood samples and see if you have a problem in your kidney, or if you have a story in your family that you have hepatic impairment, let's see. It will tell you, please don't use this drug, change for another one. So we have small, tiny examples of how intelligence can support. That was the first part. I think it's a thing about data anonymization that is still a point. Second part, there's a money thing here. So there's a curation on the data that is not clear for everyone. And because it's not clear, and it's not just legally, like in terms of business model, it's not clear for everyone, I think that is where the game needs to change quicker. Because as soon as it changed and we can see the curation of the benefit on data for everyone, data would be available. I hope I answered.
Thank you. We have two more questions over there.
Hi, Sofia. Thank you for the presentation. So, if you look at the electronic health records when it was launched, there was a big aim. It will help continuation of care, patient satisfaction, and whatever. And then a study showed that EMR, it has eroded patient-doctor relationships, because now the doctor is spending a lot of time clicking things and looking for data here and there. So it didn't do the job that it was meant from. Instead, it eroded the relationship. So how do you see AI impact on patient-doctor relationship, especially when you show the future hospital. So I don't see the doctor. It was all program and whatever. So where is the doctor in the loop, and how the relationship will be affected?
Great question. So that question, again, I can answer in two steps. One, the present, and how I see the future. So in the first one, I didn't put the doctors, but each chair there would have a professional, a doctor, a nurse, or someone else. But first part, we are already using a tool that we call nothing to do with the complete mindset, which is we have an AI system that actually does a summarized assessment to all the information that is in the EHR of the patient before I have a consultation with the patient. So when I have the patient in front of me, I have summarized topic info from the topic I wish for. So imagine if I have, sometimes patients have like 30 or 40 blood samples from different times. It has a summarized trend on how it went, all the information that comes from the back. It's already summarized with generative AI. We are testing it, okay? Why are we testing it? We are validating that the capacity of the generative AI is not to hallucinate and to give us real information. That's why it's still in testing. But I think this is a very good tool on how, in a very good way, on how AI can actually play a huge role. It saves a lot of time, gives us information curated already on what I wanted. Second step, I think those towers that I was talking about, we can call them different ways, but these control towers are very interesting because you can centralize information in the professionals that take decisions. But real information, like centralized information that comes from your hospital, from the EHR, but also from the outside, from what the patient can give you and give inputs, or from other institutions where the patient was. So this is probably one of the main features for the future, which is one professional is super specialized, not only in a topic from healthcare, but also in a patient. Imagine that you have 2 or 3 doctors that follow the same patient for years in a longevity version. That will give you a huge capacity to take decisions and to cooperate with the patient for the decisions. And there, of course, AI plays a huge role because data is getting larger and larger, and it's humanly impossible to manage it. I hope I answered.
Thank you. I see we have one last question, so please make it really short.
Yeah. Hello.
And then we can continue.
Hi, Sofia. My name is Kanesk. I'm founder of a startup called Prognosis AI. So we are in the stealth mode, so you wouldn't find more about us. So question for you, right? So as we are in health tech space, I'm really glad that the lady in the front asked the question about EMR. So that's what we are trying to solve it, rather than having a huge monolith. You want to give some 360 information about the patient, which is not so much like text, but like graphical. But my question to you from a startup is, right, so as a startup, we are always constrained about data, right? We only have certain accesses of it. Now, there is a huge push, not in the health sector, but in other sectors, that there is a way to generate synthetic data that, like where a lot of startups are trying to train it. My question to you is that the right thing to do for a health tech startup? First thing, right? Secondly, you said you have trained a lot of your models on a lot of data that you already have because you have been associated with healthcare, right? The question is, are you creating your own LLMs, or are you banking on Llama 3.1s or so, and then fine-tuning them or using RAG for them? So that would help us, to figure out how the more traditional healthcare things are doing.
Okay, very good questions. In a nutshell, first one, we work with a lot of startups, so at least for our size, so we are a 400 to 500 million top-line hospitals group in Portugal, just to give you our size. So we are big for Portugal, not big for the world, but we worked with around 90 startups last year, with whom we have specific agreements so that we can share data. Nevertheless, when you talk about rare disease or shorter fields of data, we use a lot, or we insist to use a lot of synthetic data in specific fields. And we do cross studies. So we have studies with synthetic data and with the data that we have in this federated learning approach, and then we cross to see how the output would work. This is one part. Second part, LLMs from us or from the others. We are using external ones. Most of them are open source ones in general, because we use through a partner. We don't use it directly. So we, as a hospital, do not develop or use the technology directly. We hire always a middle partner so that we can, that are specialized or more specific driven to something, for a very simple reason. First, we are not an IT company, and we want not to be like that. So we only do management, not development. We co-develop a lot, that's true. And on the other hand, we think, and I strongly believe, that when a startup or a company has a specific product, they are much better than us in why they are doing it. So they know much better the problem, they have a solution that is already created and much better than what we could think about. So what we are interested on is to share and partner with them, much more than to substitute.
Thank you. Okay, I'm sorry, we have to go. But thank you so much. That was really amazing, Sofia. And we're going to continue. Yeah, of course.